We are going to get started. Thanks again to everyone for joining us today for our virtual forum on the role of advocates in the mental health and addiction industry. Today's presentation comes to us at a time when advocacy is required by more people on a daily basis than ever before. I mean, just personally, I know just in the healthcare system, individual advocacy has become more critical. And we've got two true subject experts to help us learn how to use it to our advantage for both ourselves, but also our patients. We're very excited to have Mental Health America's Catherine Reynolds as our presenter today. Catherine's been with Mental Health America since 2017, and her dedication to mental health advocacy, disability rights, and addiction treatment is deeply rooted in her personal experiences, driving her commitment both in her professional endeavors and her personal life. I've seen her present before. I know you guys are going to love this content today. Also, because she's joined by Crystal Barajas, she is a BrightView Community Outreach Manager in Louisville, Kentucky, and I feel a perfect example of advocacy in action. She is, in 2023, she was nominated for the Barrier Breaker of the Year Award by Michael T. White Recovery Boldly Awards, and she is a true asset to her community and to BrightView, spending her time advocating for people who are unhoused and needing addiction treatment. And with that, I will let them get to it and let Catherine begin.
Good morning, everybody. I'm so thankful to be here. And I'm also grateful to be sober this 21st of February. I'm going to be sharing a little bit about my experience with mental health recovery and addiction recovery, and talk to you guys about the building blocks of advocacy. So I was 19 years old, and I was a sophomore in college at the University of Alabama when I was faced with a very critical decision. I had just returned to college after an outpatient stay of 30 days in Birmingham and a semester of medical withdrawal. My best friend had asked me if I was interested in sharing my story in a student newspaper article about mental health. I had planned on going anonymous in the article because that's what I thought was expected of me by my friends and my family. The article featured my story about living with bipolar disorder and all my struggles and triumphs. The night before the article was released, I had a moment of clarity. I thought to myself, Catherine, aren't you passionate about mental health? Aren't you studying addiction? Don't you want to be a therapist? And I had the realization that if that's truly what I wanted to do, that maybe this was the opportunity to live in my truth. So in the hours before the article came out, I decided to put my name in the article alongside my story of self-harm and of inpatient and outpatient, of struggles and heartaches and car accidents. And I was so incredibly nervous, but I knew it was the right thing for me to do. The response to the article was overwhelming. I had people that I knew and that I didn't know reaching out to me. I had people's parents from my childhood reaching out to me. I had no idea that by sharing my story, I was going to meet so many incredible people. As a result of the article, people on my campus reached out to me and asked me if I wanted to get involved in a new student organization they were starting at the University of Alabama. I got involved and helped found a mental health advocacy organization at the campus. I got to lead campus support groups, do campus demonstrations, and it 100% changed my life because for the first time, I was living in my truth, I was living authentically, and I didn't have to feel like I was alone as someone living with bipolar disorder, which up until that point had been a secret that I felt like I had to carry around. I didn't know it at the time, but I was doing something that Clifford Beers, the founder of Mental Health America, would call fighting in the open. Clifford Beers said, let us fight in the open for people with mental health conditions. And to me, that means being unafraid to share my story, knowing that it's important for people with mental health and substance use conditions to show up fully, to create representation for one another so that we can help break stigma and drive more people to care. My name is Catherine Reynolds, and I am the Events and Meeting Manager here at Mental Health America, where I've been so happy to be employed for the past 7 years. Mental Health America was founded in 1909, and our mission is to advance the mental health and well-being of all Americans through direct service, public education, research, advocacy, and public policy. We drive progress with a public health perspective through our community-based solutions and a national agenda. Shout out to one of the people in the chat who's from Alexandria. That's where our national office is based. Next slide, please. Mental Health America, as I mentioned, was founded in 1909. We actually just celebrated our 115th anniversary the other day. And we were founded by this man on the left, Clifford Beers, who was a person living with manic depression, at that time called manic depression, what we now know as bipolar disorder. And in that day and age, Clifford Beers was housed in institutions and faced atrocities, being abused through the asylum system in this country. And he chronicles his experiences in his autobiography called A Mind That Found Itself. And in 1909, he founded a social reform movement for mental hygiene and founded the National Association for Mental Health, which is now known as Mental Health America. On the right, you can see this beautiful 350-pound bell. It's called the Mental Health Bell or the Bell of Hope. It's featured prominently in our Mental Health America logo. It's the first thing you see in the office at Mental Health America when you visit us in our national office in Alexandria. And it's a really big piece of our Mental Health America conference. And on it, the bell says, "Cast from the shackles which bound them, this bell shall ring out hope for the mentally ill and victory over mental illness." Now, this bell is literally cast out of the shackles from people with mental illness. So back in the days of institutionalization, people with mental illness were literally shackled to the institutions that they were housed in. And so in the 1950s, when the government closed down a lot of these institutions, Mental Health America asked for those shackles to be sent to us. We melted them down and we cast this beautiful 350-pound bell. And it's a really great reminder of how far we've come and how far we need to go for the fight for people with mental illness and mental health conditions. Next slide, please. A little bit about what we do at Mental Health America. We work on lived experience in science and solutions. Mental Health America was founded by a person with lived experience, and we really strongly believe that's important to incorporate people who have lived through the types of treatment and care. A lot of times when people are creating programming or coming up with outcomes, the people who are the end user are not really thought of in creating those programs. So we really stress lived experience in all of our programming. I'm going to get into a little of our resources that go on through my presentation, but I'm going to highlight our big 4 areas that we work on. We work on research and screening. Our Mental Health America screening program is a free online tool where you can go on right now and access a free mental health screen. I'll touch on this resource a little bit later. We do things like the State of Mental Health in America report, our Mental Health America mapping project. Our youth and peer leadership programs help us highlight the work of young advocates, and we've helped a lot of young people start their careers in advocacy. Our public education and workplace programs reach millions of people every year, and we even founded Mental Health Month, which is recognized in May back in 1959 or 60, I believe. We produce lots of free toolkits that can be accessed on our website that I'll tell you a little bit more as our presentation goes on. And lastly, we have our advocacy and public policy work, which is something that we're really known for, advocating for different legislation and new laws to be passed to support the rights of people with mental health conditions. Next slide, please. So there's many pathways to advocacy, and that's absolutely one of my favorite pieces of advocacy. I know I got into mental health advocacy because of my personal experiences. I was diagnosed with bipolar disorder as a teenager, and I never could have known that I could have started a career or been able to make a difference. So I'm wondering if there's anyone who would be willing to share about why they got involved in the mental health and addiction field with us in the chat. Anyone who's willing to fight in the open, and I'd love to highlight your responses if anyone is comfortable. Next slide, please. So an advocate is someone who uses their voice or takes an action to support a cause. Very plainly, I think that everyone is an advocate in their own way. And that's a concept that we're going to be able to explore today in this presentation around just all the different ways that one can be an advocate. I think a lot of times when we think of advocacy, we think of it in a professional context. But when you think about it, how many times a day are you using your voice to speak up for somebody or supporting a friend or setting a boundary for yourself? As we explore the different ways you can do advocacy, hopefully you'll realize that you're practicing advocacy more and more on the day-to-day than you might realize. Next slide, please. So what are the building blocks of effective advocacy? I broke the building blocks of effective advocacy down into 4 major steps. So I know in the room today, in our virtual room, we have a lot of case managers and social workers, people who work in courts, people who work in prisons. And So I want you guys to think about what actually needs to happen for someone to come and receive our services. And I'll highlight Rosemary's comment in the chat. They said that I ran mental health group homes for 15 years and then went to the addiction side. Very rewarding work. Thank you for sharing that, Rosemary. So the first step in building blocks of effective advocacy is someone needs to be willing to understand their priorities, right? So in order for a person to come see you in your place of work or to come see you in your treatment center, they need to know what they want to work on. I know sometimes people who see us in our facilities it wasn't necessarily their choice to get there, but hopefully by the time you've been able to meet them, they've had to start of some understanding of what they want to work on. They've identified something they want to change. And that might not always be the piece that they end up working on with you, but it is something that's super important. As we all know, the first step in helping someone is that person understanding that they want to make a change. And as we know, it just takes one little glimmer, one little motivation to change for someone to start that journey. Someone needs to be willing to take an action. So they need to first have identified that they have a problem. And sometimes this can take months or years between the idea of someone recognizing that they have a problem and being willing to take an action. And as we know, as addiction and mental health professionals, there's no forcing someone to be ready to take that. But in order for us to help that person, they need to be willing to take that action. And then they need to be educated about their options, right? So in order for people to come see you in your places of work or to come to your treatment facility, they need to know that you exist. So it's really important for people who are receiving services to have access to your website, have access to their information about what different treatment options are available, which I know is something that some of the people in this room help people do every day. And lastly, we need people to be able to communicate their ideas. So in order for us to effectively help somebody, they need to be able to communicate what's going on with them. So these 4 steps are the building blocks of effective advocacy. And I want to hopefully put in perspective really what it means when someone comes to you for help. They are doing advocacy for themselves. Although it can feel disempowering at the moment someone reaches out for help, in the long run, it's a huge act of strength when someone is willing to come to you and surrender. I'm going to highlight some of the things from the chat. Thank you so much for sharing, everybody. So Terry said, I worked in the North Carolina prison system and realized most of the people I was dealing with had behavioral health and mental health and substance use concerns. And those concerns were front and center of why they were in prison. Justin is sharing his experience in recovery. Congratulations. 15-year recovered meth and benzo addict. I got out of the drug scene years ago, and about 5 years ago, all my friends began to OD and die. I couldn't stand by and watch it happen to anyone else. Justin, thank you so much for sharing that. That's exactly the kind of points that we're talking about here today. A lot of times people get into advocacy because they've experienced things themselves and they don't ever want to see that happen to anybody else. And I know that this is true for other types of professions, but I think it's really profound to think about the reasons why people get into our industry. We all know that when someone says they work in mental health and addiction, there's maybe a good chance that they've had a personal experience with it. Next slide, please. People are sharing their experience of living in addiction and their professional experiences, and we really appreciate all the support for that in the chat. So what are the major types of advocacy that we're going to be talking about today? There's systems advocacy, which means to advocate on behalf of a better system, to do that organizational change. It means not just on the government level, on the state, local, or national level. Systems advocacy could be done in your school district or in your workplace, or you know, at an organizational level. It doesn't always mean that it has to be happening in the government, although that is one of the types of advocacy that we're going to be covering today. Next, we're going to talk about individual advocacy. Individual advocacy very plainly means to advocate on the behalf of another person. And I think that individual advocacy is that type of advocacy that we do all the time. It's that advocacy that means taking care of our neighbor or reaching out and checking out on a coworker. And then lastly, we're going to talk about self-advocacy. And self-advocacy is super important to me. As a person living with mental health and substance use condition, I feel that self-advocacy is one of my strongest things that I practice on a day-to-day. And it's definitely one of the entry points for me into a professional advocacy. I'm going to read some more from the chat because I'm loving all these coming in, and I really love the support for everyone congratulating us on each other's recovery. I think that's one of the special places that we get to work in. We were talking about before the presentation started. Not everyone gets to talk so openly about these experiences, so I'm really happy that you guys are creating that atmosphere in the chat. Kelly says that they have a lived experience with both substance use and mental health and wanted to be a part of the solution and no longer seen as a problem. They'd also encountered many professionals that cause more harm than good, and they wanted to be a part of the change. Thank you so much for sharing that, Kelly. Next slide. So systems advocacy, as I mentioned, is that kind of macro level advocacy. It's what happens when you seek to make changes on a local, state, or national level through laws and policies. So Mental Health America is a national advocacy organization, and we're one of a number of advocacy organizations who do that macro level advocacy at the state and local level. We go to Congress, we talk to legislators. This is one of my coworkers testifying about ghost networks. And it's a really good way to start making change that affects a lot of people, but it's really broken down by a lot of small actions that support the efforts. A few of Mental Health America's 2024 policy priorities include promoting the importance of lived experience, advancing prevention and early intervention, increasing access to mental health and substance use care and supports, and ensuring equity and reducing disparities. You can learn more about these issues and the bills if you go to this link at the bottom, which will be emailed to you, or visit mhanational.org/policy/2024-priorities. You can actually see the different bills that are currently being considered in Congress that support each and every single one of these aspects. I think it's really important to connect the fact that lived experience does have legitimate implications in a policy sense. I think that sometimes when people think about lived experience from the outside perspective, they don't necessarily understand that it really has far-reaching implications for policy, and that policy can be informed by lived experience in ways that are beyond just sharing your story, which is of course super important. But lived experience is important in policy because, again, because of those outcomes that you might not be aware of, or what are the detrimental effects of having a ghost network, meaning what does it really mean when someone is struggling to find care, but they can't because insurers' websites are out of date. So when we're talking about the role of lived experience in policy, it's really exciting to think about how those things come to fruition. Next slide, please. So this is a really great chart from the Ontario Nonprofit Network that kind of shows the spectrum of advocacy. So advocacy can be done at, all the way from the downstream level, which means kind of actively responding to things that have already been set forth by the government or by an institution. So that kind of means reacting and responding. So that can very plainly mean, sharing a policy idea on social media, joining a coalition, voting is a way to do advocacy. And that goes all the way to more of these upstream types of advocacy, which means really more being a little bit more actively engaged, helping form policy, helping write legislation. So some upstream policy advocacy type things you can do are meeting with cabinet people, organizing a lobby day, starting or joining a legal challenge, starting a community fund. And so no matter what you're doing or the type of person that you are, there's actually a way that you can get involved in this type of systems advocacy. Next slide, please. I'm going to take another opportunity to share from the chat. I'm seeing a comment from Wanda. Wanda says, "Good day, Wanda Graham. I got into advocacy because of my nephew who is an active drug user, and I wanted to find out other resources to help him and his friends. So many of his friends are ODing, and I worry one day he will not be here. I feel like this is such a problem with all ages and different people and walks of life. I work for Communicare Mental and Behavioral Health." Thank you so much for sharing that, Wanda. I totally relate to that. I didn't think that fentanyl was affecting my community until someone a year older than me passed away from a fentanyl overdose. And it was a really sobering wake-up call to understand that this is a widespread problem. So again, thank you everyone for sharing. If you guys want to keep sharing about why you got involved in the industry, I'd love to highlight that and help carry on the conversation in the chat. I just want to validate everyone for sharing because it's super important. The next type of advocacy that we're going to talk about is individual advocacy. So this is what I mean when we say, I think all of us are doing individual advocacy way more often than we think we are. So it's when a person or a group that helps people find solutions to problems, access information, voice concerns, and learn about available support options. Now, individual advocacy can be formal or informal. I'm betting a lot of people in the chat, in the audience today, you guys might do formal advocacy. You might be case managers and social workers. But have you ever thought about the work that you're doing to advocate for your child to get better access to supports or services? Have you ever thought about how, if you've ever attended a doctor's appointment with a loved one and helped communicate with their provider, that's doing advocacy. It's everything from little things like, talking to your friend who's just had a breakup and suggesting some resources to them. I really encourage you guys just to think about, again, all the ways that you support people and think of it in terms of advocacy, because I think it can be a really empowering way to think about what you're doing. So again, just that individual advocacy, it can be formal or informal. I know some of you guys might be doing this in a professional sense. Next slide, please. So self-advocacy is an individual's ability to effectively communicate their needs. I know that self-advocacy is something that's oftentimes brought up many times in the context of healthcare needs, right? If you look up self-advocacy, you might see things about self-advocacy for people with disabilities or mental health conditions, and that is 100% true. But I also think that self-advocacy is something that we should all be thinking about. I think that self-advocacy in a lot of ways is the same as self-care in many ways. It's about how we show up in our daily lives and talk to people about what we need. Self-advocacy skills are life skills. It means advocating for yourself in healthcare and relationships and at work. Self-advocacy is everything from taking a break. It's everything from getting some water when you need it. It is setting a boundary with a person. But self-advocacy is also like asking for care or seeking accommodations or telling your supervisor that you need a new work schedule so that you can, go to therapy. What I think is really interesting about self-advocacy is that people who self-advocate are more likely to thrive in school, work, and life. It's also super cool that self-advocacy skills can be learned at any age. So, even though you might not have been someone who was good at speaking up for yourself as a child, that doesn't mean that you can't learn how to be better at that as an adult. I wanted to share a little note about mental health in the Americans with Disabilities Act while I have the moment to. So as I mentioned, I'm a person living with bipolar disorder, and I didn't know that bipolar disorder was considered a disability until I was 24 years old. I'd already been to college. I'd already started my career in the workforce. And I had no idea that I had legal protections under the ADA that had I not, worked at a mental health advocacy organization and luckily been in an environment where they were very much pro therapy, that I could have talked to my employer about getting time off from work to go to therapy. I learned about the Americans with Disabilities Act and the founders of the 504 sit-ins who bravely protested for the 504, kind of escaping my mind, inclusion that would allow disability to be considered at like the federal level. What I find really interesting about the history of the ADA is that initially people with substance use conditions weren't going to be included in the ADA. But advocates on the ground there fought and said, people with substance use conditions are just like us. They deserve to be included in the ADA. And I don't know about anyone in the chat, but to me, I'd always kind of observed a pretty big chasm between the mental health community and the disability community. But then learning about how people with maybe physical health disabilities were advocating for people with me like an invisible disability, it really challenged why I was unwilling to identify myself as a person living with a disability. We're all protected by the same laws. We're all protected and have the same rights under the ADA, but I think a lot of times people in the mental health advocacy community are quick to distance from ourselves from the disability community. So that's just my little plug for us, to kind of have you consider any stigma you might have associated with the disability community, or any opportunity that you might have to rethink about mental health and substance use in the context of the ADA, because I think that language and thinking about it in terms of that can really help people, not just with access, but with advocacy, because the experiences of a person with a physical disability and the experiences of a person with a mental disability or non-visible disability might be different, but they're also quite similar in a lot of ways. We face isolation, we face stigma. And so I personally think that our industry would be a lot healthier if we helped incorporate disability advocacy into our mental health and addiction advocacy. I'm going to share again, right again from the chat. Susan said, I attend health fairs, wellness activities, networking opportunities with Al-Anon and family groups. Have heard of AA, but lots of folks do not know about Al-Anon family groups worldwide, non-religious, no dues or fees required in fellowship. Thank you for sharing that, Susan. Next slide, please. So I want to tell you guys a little bit more about my experience with self-advocacy. I truly appreciate everyone sharing their lived experience in the chat. As I mentioned, I was 17 when I got diagnosed with bipolar disorder, and I didn't know it at the time, but I've been practicing self-advocacy from a pretty young age. I was about 14 when I started to have pretty extreme mood swings, and I just started to identify that things were happening to me that I did not think were normal. And I asked my parents if I could go to therapy, and thankfully there was a lot of access and privilege that it allowed me to start going to therapists at that young of an age. But it's important to me because, as I'll explain, every single major mental health decision in my life was my choice. And I think that's because at a very young age, I had clinicians and I had people around me who let me know that I was right and that I had the opportunity and I had the education to identify and say, something's not right with me, I need to seek care. And so it was self-advocacy my junior year of high school, when I was studying for the SATs and I was having really, really horrible thoughts of self-harm and suicide. And I decided to go and take a mental health screen. I had access to information. Again, going back to those building blocks of advocacy, I had access to mental health information on the internet, thankfully. I took a mental health screen, and I actually talked to my doctor and said, hey, I think I have bipolar disorder. More and more you are hearing people like that today be able to have gone online and start getting little inklings of what's going on. And I know it's kind of a controversial topic with the internet and people, quote, self-diagnosing themselves and things of that nature. But when you peel that back a layer, what you see is that people are curious about themselves. People are wanting to identify what's going on with them, and they're seeking change and they're seeking a better life for themselves. No matter if the diagnosis is accurate or not, if it's from TikTok, what's behind that behavior? That person is saying, hey, I've identified that there's something in my life I want to change. There's something in my life that's uncomfortable to me and that I would like to change that. So that was self-advocacy. And I got diagnosed with bipolar disorder at 17. And I graduated high school and I went to college, and college was an absolute nightmare for so many reasons. But you know what? As a freshman in college, I knew two things to be true. I knew that my mental health was a thing, right? Luckily, I'd had those experiences. I was able to say, hey, I have bipolar disorder. I'm going to have to take care of myself differently than other people. So I knew that mental health was a thing and that I would have to pay attention to it. And number two, I knew that I was in a position to identify what I needed. It started to build a lot of confidence in me. And when I look back at that time, I think, wow, how brave and how powerful and how smart was I to have been so young and been able to say, hey, I think that I need help. Because it's interesting, if you talk to my parents about that time in my life, they would not have said, hey, yeah, you need to go to therapy. And I think it's that evidence that nobody knows yourself like you do. You are the expert of your own experience. No one was going to come and save me and take me to therapy. And that was kind of a theme that continued on up until now. Um, it was self-advocacy when I called my friend in the middle of a mental health episode, and I asked my friend to take me to the hospital, and I needed to go to I needed to go to inpatient. It was self-advocacy when I decided that I needed to go to outpatient in college. So the photo on the left here is a picture of me with my Crimson White article that I mentioned. And the photo on the right here is a picture of me with my first sponsor in Alcoholics Anonymous. It's a really big privilege today to be able to share a little bit about my experiences being in recovery from drugs and alcohol. As I've just explained, I've kind of been talking about mental health for a long time, but drugs and alcohol was something I never thought I would be talking about publicly because I never knew I had a problem with drugs and alcohol. But I have been sober for 325 days, and in 40 days, I will hit 1 year of sobriety. And that is an act of self advocacy when a year ago I decided, hey, I don't like the way where my life is going right now. I think I'm drinking too much. I think I'm smoking too much. And I have to share it. I have to thank my clinicians for even bringing this up and validating this to me after a really bad blackout. I told my therapist, "Hey, I don't ever want to black out again." And she was like, "Well, you're not just going to stop blacking out on your own, you know? You're probably going to need to talk to a substance use counselor." And it was absolutely mind-blowing, and I was so scared, and it was the first time anyone had really used the word addiction or alcoholism to talk to me. Um and, I spent about a month in my pre-contemplation period, as I call it, considering maybe on whether or not I should actually get sober. And later on, my therapist would validate me. She told me, "Thank you for being able to listen to me." And that's something that I hope you guys take away from this presentation as I get onto a little bit later. When someone expresses that act of desperation that they have a problem, please validate them. Please acknowledge that what they're doing is hard and it is scary, but that will help grow the confidence of that person, because I know that if I hadn't had all these early experiences trying to navigate care, it would have taken me a lot longer to decide to get sober. So thank you so much for letting me share this, my little story of self-advocacy. Thank you so much for the love in the chat. I really appreciate that, being alongside some, uh, supportive friends in the chat. And I have, next slide, please. I'm going to run through a few Mental Health America resources to support advocates. As I mentioned, we have the Mental Health America Screening Program, which has screened over 20 million people to date at mhascreening.org. You can go online and take a free mental health screen for about 10 different mental health conditions. This is an example of how you can do that individual advocacy and that self-advocacy. The Mapping the Mental Health of Our Communities is an interactive heat map where you can actually go on our website and filter by different types of condition and different areas of the country, and you can see how many people are experiencing, for example, suicidal ideation. So this is one of those tools that you could take to someone in your community, like an employer or a legislator or a city council member, and you could say, "Hey, I know you don't think this is that big of a deal, but please look at this map. This is happening in our community." This is a really great tool for that kind of data. Next slide, please. Then we have some other resources. As I said, we have a lot of public education programs. I always like to make this plug. We have so many free resources on our website. Please utilize them. We create toolkits for every major different awareness month every year. Mental Health Month. The State of Mental Health in America report is a report that rates all the 50 states in the District of Columbia on access to care. And we also have a blog and a podcast and some opportunities for youth engagement. Next slide, please. I want to make a note about supporting everyone involved in the decision-making process. I think representation is super important. So when you think about your organization and the stories that you're sharing on social media, how can you share the stories of not just the end user, but maybe a family member or an employer? I think the really cool part about mental health is that you don't have to have a master's degree or be a counselor to be the giver of really vital information. Sharing screening on your Instagram story, sharing mental health resources online. You never know who's going to see that. Um, See how you can maybe share stories about a parent who didn't really think that mental health was that big of a deal, but then how it absolutely changed their child's life. Help create representation of people whose lives have been changed by mental health, because as we know, mental health doesn't just affect one person, it affects their entire environment. Next slide, please. So by being engaged, you help create community with those around you, and community creates a sense of thriving. That's absolutely been the case for me. Next slide, please. These are some questions and considerations I have for you guys. So consider how you can promote advocacy at your organization. Think about how you might be able to, have a Hill Day or a letter writing day, or use Mental Health America's advocacy tools to, we have advocacy alerts that you can send automatically to a person, and it will, write a letter automatically to your state rep. How can you use systems advocacy types of activities to help people feel more included and a part of the community? How can you support an individual's confidence to continually pursue growth? As I mentioned, I think this is one of the biggest things that has affected my recovery as a person, is that I am confident in my ability to ask for the things that I need. I like to say to people that you could be the best therapist in the entire world, but unless your client believes that their life could change one day, they're never going to be able to be benefited from all your great work. So please, please, please just continually support people in how they exercise self-advocacy. And then lastly, how can you model self-advocacy to your peers and loved ones? Really consider how you can show other people in your environment, like your coworkers, to be a good example of self-advocacy and practice self-care. Next slide, please. So again, I just wanted to go over the building blocks of effective advocacy that we talked about at the beginning. You want to understand your priorities, be willing to take an action, be educated about your options, and communicate your ideas. Next slide, please. So the mental health of our communities rests on individual and collective advocacy. I really do think that advocacy is what makes our industry what it is. It's what helps people come in the door. It's what helps people keep coming back when they need that help. So that's just my plug to really think about how advocacy supports the work that you do, how it helps you maintain a job, that people are doing advocacy on behalf of themselves or a loved one, that keeps your clients coming in the door. Next slide, please. And lastly, in advocacy, there is community. I think we're seeing evidence of that here in the chat. Thank you to everyone who shared their story and shared support in the chat for everybody. I know you might be involved in this field because of the community that you found, the people that you serve, and the people that you work with. So I hope in advocacy, you also find your community. Thank you. Next slide. I think that's it. And I'll pass it to Crystal.
Hi, everyone. I'm Crystal Barajas. Want to go over the importance of advocacy and addiction treatment. First thing is accessibility. Knowing where to look for treatment, what treatment options are available, whether that's inpatient, outpatient, partial hospitalization, intensive outpatient services, and then knowing if you're looking for dual diagnosis services as well. Of course, we know that mental health and addiction often go hand in hand. Education and awareness. Understanding that there are many layers of disease, of addiction. There's no one-size-fits-all approach to this, and everyone's journey looks different. Community support and collaboration is vital, that we all come together and support mental health providers, addiction treatment providers, and just really spread that awareness of the resources that are available out in our community. Prevention and harm reduction. This is huge. I know in Louisville, we have harm reduction services for syringe exchange, safe sex practices, HIV testing, And this is all examples of harm reduction for the population that we serve. One person in treatment is obviously the goal, because that's one less person that's in active use. Challenging stigma. This is huge for me. I started in addiction treatment over, almost 3 years ago, and I had no idea that some of the language that I was using was stigmatizing. So learning that, the appropriate language to use and sharing that with community partners, challenging your local law enforcement or your, local community leaders to use that appropriate language versus, to reduce the stigma. Confidence. Confidence is huge. Asking the right questions, being an advocate for yourself, being an advocate for your patients. It's all about making sure that you are speaking up for yourself and being confident and asking those right questions. Next slide, please. My story. I've been advocating at many levels and really just had no idea that I was doing so. I quickly found out that addiction, I'm sure most of you in the chat can agree, it's not a BrightView problem, it's not a Mental Health America problem or a law enforcement problem. This is a community issue. We all need to kind of come together, educate ourselves, be aware, know what resources are available, so that way we can all work together towards fixing this issue. Who can be our voice? Knowing who the advocates are and the leaders are in your community. I know for Louisville, for example, that can be, organizers for local community ministries. It could be Metro Council leaders. It could be your division resource officers. Just knowing who is open-minded, who is willing to understand addiction and mental health, who's willing to put in the work and break down barriers together. Those are your voices. Identify resources. Some of the leaders may not be informed about addiction treatment. I'm sure many of you know who work in this industry. If you're having conversations with some of the politicians, some of even healthcare, they don't understand what addiction treatment is. They're not familiar with medication-assisted treatment. Just some, harm reduction services. So really going in and educating those community leaders is vital, because they often are the ones that are, deciding where funding goes for the unhoused, harm reduction services, addiction treatment ministries, things of that nature. Aligning yourself with the right organization. The law enforcement, for example, they're a tough group to navigate. I have found that not necessarily going into the organization as a whole, but talking to them more one-on-one has oftentimes been more successful for me than engaging with them in a group setting. They're more open to hearing what you have to say when you're one-on-one, and they're more open to hearing statistics. They want to hear about not necessarily the heartfelt stories as much as they want to hear they're data-driven people typically. And then, for example, for law enforcement, don't just reach out to your beat officers. Reach out to the victim services unit if they have one. Reach out to the crisis intervention team, even the command staff. These are all great people to align yourself with to further spread the message of services that are provided within the addiction and mental health realm, because they are often seeing our people on their absolute worst days. And if they don't know what resources are available, then we're just going to continue to be in a vicious cycle. Exposing barriers and reminding them that compassion fatigue is real, and so are human lives. Showing how providing substance use disorder patients with resources can make them productive members of the community, which is a benefit to all. I know all of this is hard. Interestingly enough, a little bit about me, I've been with BrightView for 3 years now, and It's all led me to running for local Metro Council. So learning that specifically in my community, there is a huge lack of resources for mental health and addiction treatment. And for me, that just simply wasn't good enough. We need resources in this end of town to be able to help combat addiction, mental health, and the homelessness issues that we face here in this community. So that's obviously not an option for everybody, but just remembering to advocate wherever you can, be a voice, get in front of your local community leaders, form a coalition of sorts, and help tackle all these issues together. And that's all that I have.
All right, this is great. Thank you so much to both of you. We're going to do Q&A now. Really appreciate everybody's engagement within the chat. We also just put out there 2 links, one to slides as well as a certificate of attendance, and another one to register for our next forum on the justice involved. And one of the reasons I share that is, Crystal, I know you shared some of your experience working with law enforcement that's been really helpful. And we do have a question from one of the registrants regarding that topic. How do we convince the police and courts that jail is not the appropriate treatment, in quotes, for those who suffer with long-term substance use disorder and have repeated minor law infractions?
Yeah, I think the most important thing is to remember that there's no one-size-fits-all approach to anyone's recovery, road to recovery, right? When it comes to the police, law enforcement, and the judicial system, it's all about showing them the stats, reminding them that these are people at the end of the day. They are someone's mother, brother, sister, father, etc. And and just reminding them that addiction treatment is effective. So they are data-driven people. I would start with the patrol officers. They're the ones that typically, often, at least in Louisville, they can recommend a treatment option versus more jail time.
That's great. Thank you. And another question we have is, how would you advise someone that does not have direct patient contact, but looks at advocacy through more of an organizational lens? This is from an individual who feels that their voice doesn't really hold as much weight since they aren't on the front lines with the patients. I think you probably might both be able to offer some assistance on that one.
Catherine, do you want to go ahead?
Oh, you can, if you want to start, you can.
Oh, sure. Again, just because you're not on the front lines doesn't mean that you don't have a voice. It's getting together with local. There's a lot of ministries here in Louisville. To get to know what ministries are in your area, what coalitions are in the area, and just get involved, whether that's volunteering, whatever it is your craft is, whatever your skill set is, and offer that. That's the best way that I know how. If you're not necessarily on the front lines, just to be able to reach out and be a voice.
Excellent. Then I didn't know if you wanted to add, if you don't have to, you're not required to add it, Catherine, but if you'd like to, you certainly may.
Yeah, I mean, I completely agree with you, Crystal. I don't know if this might be like kind of more broadly, but I think it's relevant here. Like, I think that a lot of times, I think that this is relevant to like supporting people, which is like a lot of times people don't know what to say. People don't want to say the wrong thing. And people think that because they don't have that exact experience means that they shouldn't say something. And that oftentimes keeps people silenced, and it keeps people feeling lonely and siloed. And I think that the thing about mental health is that like there's so much information out there that you can do to educate yourself on. And like, I think that even if you aren't on the front lines, like you can still be a fervent advocate for mental health, and like you can bring those lived experiences that you might have like from your own personal life to the table. And And just kind of speaking to that point in one of the earlier questions around like, we know that mental health advocacy, a lot of this work is really done by personal relationships. And so like finding those people who like are going to be your biggest advocates in, you know, the court system or the jail system, and like finding that one person that could be your rock for kind of creating a lot of that change. I know that a lot of that work happens because maybe one person has found that that's a really personal issue to them, and that can really help guide the work that you're doing.
That's great. Yeah. We also have some feedback here from Dan Jackman, who is Director of Community Advocacy Relations with the Mount Vernon Police Department. And he offers up, his assistance. He has his contact information here. If somebody wants, more information on working with police departments, feel free to contact him. Really appreciate that, Dan. I think also noting that this role exists in police departments, I think is important too. I mean, that might even be sort of a general rule, is to look for community advocacy roles within the organizations you're trying to affect change in. That would be a great place to start for sure. Thank you for that. Another question, what do you think is the best way to ensure the language we're using is not stigmatizing when working with individuals in a case management setting? I'll actually kick this off. I know, in our team's role, this is always a changing landscape for better or for worse as we kind of figure these things out more and more. But I know, for example, on our blog, we have some non-stigmatizing language resources. I'm sure, a quick Google search, you'll find many. But if you guys also, our panelists also have other thoughts and ideas around that, would love to hear them.
Sure, I'll chime in here really quickly. I think I think one of the really important things here is to like acknowledge, if you're working in a case management setting, that like to say like, I'm going to use this language because this is the setting in which we're using the language. Like, I don't know if you guys have Tom Insel, the psychiatrist, the former director of the NIMH, in his book, he uses the word patience, and he acknowledges that he uses the word patience because he's advocating for a medical response, right? And he's like, people aren't going to be treated in the medical system or covered by an insurer if they're not, quote unquote, a patient. And so like my point I would like to really say there is like encouraging people to say like, I'm going to use this language because this is kind of like the protocol, but I encourage you to find the language on how you want to describe yourself, and acknowledge to that person that like, especially when it comes to things like identity, like my relationship with mentally ill, mental illness, bipolar, I am bipolar, I have bipolar, has changed over time. And so like getting back to that, like, how can you instill confidence in people, like to understand that you could be thinking that you're saying the right thing and that person might actually prefer the other thing. But I think what's important is to encourage that person to like acknowledge that like this is how you're going to speak, but encourage that person, or even try to adopt that language. Like I think you can also like ask like, do you prefer person first language versus identity first language? And I thought it was really interesting that like in the mental health advocacy community, a lot of times we use person first language, right? And in the disability community, a lot of people really like enjoy identity first language. So I think that's a great question, and it's really important to think about. So encouraging that person to like, one, let you know how they want to be referred to, encourage them to just find what feels right for them and try to adapt.
I think your point about asking first makes a lot of great sense. One of the ways I've seen that done is people recommend that you start that conversation off. Like, I could say, I use he and him pronouns, what do you use? If you feel like that's sort of where the conversation's heading, for example, you start out by sharing a little bit about yourself. I think, on that aspect as well, just putting things like that into your email signature, for example, shows that, you support that. So any way that you can do that or initiate that conversation, I think is really smart.